networking, and professional development among students, faculty, and alumni. During the discussion, please feel free to type any questions for Riley in the chat, and we'll try to answer as many of them as possible. It's an honor to welcome and introduce Riley Carpenter Frato, an accomplished comms alumnus who works full-time at the Cleveland Clinic. Riley will present tonight's session, Navigating Professional Growth at the #2 hospital in the nation. Riley Carpenter Frato grew up in Chagrin Falls, Ohio, and attended Kirtland High School. She's a proud Bobcat and graduated from Ohio University in 2016 with a bachelor's degree in communication studies. During her time at OU, Riley also specialized in health communication and minored in social work. Riley worked as a patient experience intern at Cleveland Clinic during her junior year of college. Upon graduation, she used her knowledge, experience, and connections to obtain a full-time position at Cleveland Clinic as a project manager in enterprise quality improvement. She served in this role until 2020 when she was hired as a critical care project manager in the Respiratory Institute of Cleveland Clinic, a position she still holds today. In this role, Riley had the chance to participate on the Enterprise Command Center team for COVID-19, and she currently manages ICU operations and projects across 9 hospitals. Please join me in giving a warm welcome to our speaker, Riley Carpenter Frato.
Hello, everyone. Thank you so much, Beck. I really appreciate that. And I'm so excited to be back and talking to all of you. I shamelessly have to admit, I have not been back to OU since I graduated in 2016. And while we had every opportunity or plan to do that in 2019, obviously, or 2020 and 2021, obviously, the world had other plans. So I'm hoping to make it back soon. But in the meantime, this is a great second option. And so I'm so glad to be joining you guys virtually tonight to talk through my journey in the professional growth at the Cleveland Clinic and some key strategies that I have, thinking back on my career, have really used to kind of help get me to where I am and to all of the success that I have been able to had in these short 5 years. So just a little bit about me before we get started. So I thank you for the wonderful introduction to Beck. But when I think about who I am and what really I identify as, I guess, I listed out some key things. And the first being my faith. I'm a Christian. I'm a wife to a wonderful husband who is a police officer. He's been a police officer for the past 10 years in the inner city. I'm a sister. I have one wonderful young sister. She's 13 months younger than me. 4 brothers, 2 of which are in the military, and then the other 2 are in business. And then I'm an aunt to 8 nieces and nephews, which is the best thing ever. Being an aunt, for those of you who are aunts or uncles, you know it's just the greatest thing ever. I'm a dog mom to 2 dogs, 2 long-haired German Shepherds. They're the best. And a friend. I'm a photographer. I'm a CrossFit newbie. I'm a planner. And then I'm a cook and a homemaker. And so those are kind of just some key things that really kind of frame who I am. And I think if you were to know me personally, you would probably say that those things are true. And I hope that I embody those things. So my education, I went to Kirtland High School. When I was at Kirtland, I participated in the College Credit Plus program, which was a program that high school students could partake in to gain at their community college, or if there was a university around them, to gain college credit. So I took part in that. I was involved in Leadership Lake County, which was just a leadership organization that we could partake in once a week. I was a cheerleader all 4 years of high school, and then I was a softball player all 4 years of high school as well. When I was at Ohio University, I majored in communication studies, specifically health, and then I also minored in social work. I was a part of the Turnitt Gold Foundation, which holds a very near and dear place to my heart, and participated in the Barbara Gerald Institute for Storytelling as well. So those are very, very near and dear to me. I was in Sigma Kappa sorority, and I was the president of Sigma Kappa my last year at OU, so 2016. I was in Campus Crusade for Christ, led the Greek Bible study, and then also just the general community Bible study. I was in Air Force ROTC for 2 years, but unfortunately, due to some medical challenges, I was not able to attend field training, which ultimately led me to my career at the clinic. So field training was supposed to be that summer. And then since I wasn't able to go, I ended up getting an internship at the Cleveland Clinic through one of my sorority sisters' moms who worked there. So that kind of led me to the start of my career at the clinic. So for those of you who don't know, the clinic has been ranked the #2 hospital in the nation. And it's not a ranking they take lightly at all.
Riley, you're muted. Somehow your mic got muted.
Has it been muted the whole time?
No, it just.
Oh, okay, good. So we are the #1 heart hospital in the nation, and that's something that our Heart Institute works very hard to hold and keep that trophy as well. It's a very large organization. We have over 70,000 employees. We are international, so we have locations, in London now, Abu Dhabi, Canada, Nevada, Florida, and then Ohio. We also have there's been some chatter about some expanding, so that announcement should be coming out really soon, and that's very exciting as well. So I started my internship with the clinic in the summer of 2016, and then I graduated in December 2016. So after my internship, during my internship, there were some really key things that I had learned, and it really was centered around one key individual, and her name's Serena Wiseman. And Serena was my mentor and my lead during my internship. Actually, all 3 of these key strategies we'll talk about tonight were taught to me by Serena, and I learned from her. And she was just overall a very influential person in my life overall, professionally, as well as personally. So when I was in my internship, really the primary job of my internship was, Serena was a project manager. And so I was tied to her, just assisting on different projects, creating timelines, scoping the projects, and then identifying next steps and helping to kind of follow those out. I also did a large amount of data analysis for our quantitative and qualitative data. The clinic hospital systems overall have something called CG caps and H caps. And very simply put, it's surveys that we send to our patients, and they're randomly assigned. And these surveys ask a large number of questions. And then based on these responses, it ultimately gets put back into, at the end, our reimbursement. So the amount of reimbursement we get based on the experience that the patients had. I believe last I checked, it was about 25% of our reimbursement or the decision is 25% based on our surveys. So it's actually a fairly large chunk. So my job as that intern was taking all of these comments and as well as the quantitative feedback from the surveys and boiling them down, and then providing that feedback back to the institutes and the institute chairmen so that they knew what opportunities they had to improve their patient experience. So as I was kind of winding down this summer, I started to think about my future and where I wanted to go and what I wanted to do. Project management was not something I had ever heard of in school, but it was definitely something that aligned with the type of person I was, what I enjoyed doing, and it was something I wanted to kind of start seeking out. So I started looking at opportunities, and one of the things that really stuck out to me that Serena had taught me was we would go on these walks, and it's funny because even now, as I think back to my career, and my day to day, there's so many things that get accomplished and that happen on the walks that I learned to take. So these walks would happen in the morning. We would go get coffee from Starbucks and go on a walk, or after lunch, we would go on a walk. And on these walks, we would I would meet people, everyone. Anyone that Serena ran into that she knew, and she's been at the clinic for many, many years, she would introduce me. She would introduce me, say who I was, what I was doing in patient experience, what I aspire to do, and I would just start connecting with these people. And one of those people that I had connected with on one of our walks was Kristen Mergler. At the time, little did I know, I connected with Kristen and then Guido Bergomi as well. And little did I know they would be my boss and the two people that would trust me as a 20-year-old young professional at the clinic. So 2016, December and January, I interviewed for a quality improvement project manager with zero real technical project management experience. I was able to connect my experience with the opportunities I had with the Turn It Gold Foundation and the opportunities I had with the internship. So I was hired as a project manager in the winter of 2017, that was January. And during my time as a project manager in quality improvement, I had the incredible opportunity to work on very big projects. A 20-year-old young professional, found myself at the table with the CEO of the clinic. I was presenting to Dr. Mihaljevic on hospital-acquired infections and what initiatives we were implementing across the enterprise to reduce hospital-acquired infections, what initiatives we were implementing to get feedback about how we could reduce hospital-acquired infections. And this project was, or portfolio more or less, was enterprise-wide. So we were touching London in terms of getting London up and ready. We were touching Abu Dhabi. We were touching Florida. We were touching Nevada, Canada. It was a whole breath. The other project that I really delved into was the Universal Protocol Checklist. So Universal Protocol Checklist is the process that a team goes through prior to surgery or any type of procedure. It could be something as big as a heart transplant or something as small as a mole removal or getting stitches out. But ultimately, we have a standardized checklist that everyone goes through to ensure quality and safety of the patient, to make sure we have the right patient, that we are operating on the right part of the body, and that we're removing or adding the correct thing. Kind of important stuff. And what really we came to is that, we're all human and we make mistakes. So the more tools we could implement that kind of double check us and make sure we're on the same page, the higher our quality and safety. So that was the other big project I worked on, and that too was an enterprise project. So we developed a tiered checklist and made it very user-friendly and easy for our doctors and our clinicians to be able to implement and use at the bedside without taking their focus off of the main priority, the patient. The other, the next project I'm going to touch on is, this was kind of a shock to me, and it was a really cool, it was a lot of work, but it was a really cool project, was the expiry product suite. So we had a couple instances where expired products were found in procedures with patients. And these products, anytime we have an expired product, it's considered a safety event, regardless of if it caused direct harm to the patient or not. So Dr. Mihaljevic, he had just stepped into office as CEO after Dr. Cosgrove, and he had heard of a couple instances back to back, and he wanted to stop to it within 48 hours. So I got the project. So I had 48 hours to set up a plan, implement the plan, and make sure every single location was cleared of expired products, from gloves to heart valves to any type of medication. It was everything across all locations. We worked through the night and into the morning, and then through the night again and into the morning again. And then Monday morning at 7 a.m., we were presenting to Dr. Mihaljevic on everything we pulled. We pulled millions of products and we saved millions of safety events. So that was a really cool project and just kind of off the cuff, off the whim that I got to participate in. After leaving quality, I joined critical care, and the Department of Critical Care, I joined in January 2020, and then in March, COVID hit. And so I like to say it was baptism by fire. I went right in and we started working with surge plans, accounting our beds, seeing how many patients we could take on, how many additional bed spaces we could create, what the staffing models would look like, a staffing model to care for 3,000 patients, a staffing model to care for 250 critical care patients, and then what our supplies look like, just all of the things that go into preparing for a large surge during a pandemic. So I had the opportunity during that time to sit on the command center. This was another really cool opportunity that I felt like I was almost dreaming kind of, because I'm sitting in this room, a secret room, and we were in touch with Italy, we were in touch with China, we were in touch with the president, we were talking with Governor DeWine. Any information that the clinic was getting, I was privy to in that moment. And it was unbelievable. The infrastructure that was being created within seconds and moments, the supplies that we were getting at the tip of our hands. I was finding out information before it hit the news. It was unreal. So I got to be a part of that as well, which was a very cool experience. And then COVID kind of, the surge, the initial shock calmed down, and we started to see patients with long COVID symptoms. So these lingering symptoms that we weren't really sure what they were from or why, and no one could really give them any type of treatment, but they were debilitating. And so we created the COVID Recover Clinic. So I partnered with our infectious disease team, and we stood up the COVID Recover Clinic. This clinic has now seen over 1,000 patients since we started in February, and we are continuing to expand and continuing to see a need. So those were the top key projects that, I had the opportunity to work on. And the thing that's cool is that everyone on this call, you too, could have the opportunity to work on projects like this. And I'm going to show you and share with you some key strategies that throughout all of the times and the meetings I've had, things that I have used to allow me to make connections and build rapport and be strategic personally, as well as professionally, to kind of have these type of opportunities. So does anyone have any questions about anything before I jump into the 3 key strategies? This is kind of like the next part is like the note-taking piece, I guess. Hold on. Oh, I see the chat here. Okay. So I don't see any questions yet, but if you have any, just type them in, and then I'll keep an eye on this chat here and answer them as we go along. Okay. All right, so 3 key strategies that I have consistently used and still use. The first one we're going to chat about is connection. So connection, and with every single one of these strategies, I'm going to give a couple different perspectives. And I do that purposely because I think everyone has a different perspective. And so I always like to provide, different ways of looking at things to see if that connects with you too. So connection is so important for many different reasons. So from a career standpoint, many of you have heard that, when trying to land your dream job, it's all about who you know. And honestly, that is very, very true in and of itself. There's other things that definitely play a part in it for sure, and we're going to touch on those. But really, knowing people and who you know, it helps give you that extra little push. Much of our HR process, especially at the clinic and really in any big corporation, it's ran through algorithms. So if you've started applying for jobs, you've probably noticed a lot of companies use something called Workday or another type of HR kind of program. And ultimately, you submit your resume, it runs you through an algorithm, it picks up on keywords. If your resume doesn't have certain keywords, it kicks it to the side. The problem with this is that sometimes we miss some really, really, really great candidates. And because they simply didn't have the keywords for that posting or that job position, but that didn't mean that they weren't the perfect fit. So when you have connections and you have a network, you can kind of go around that initial process. And it really plays to your advantage. So if you already know someone that works at a company that you would like to work for, being able to send your resume along or having a discovery conversation, that may provide you with the opportunity to have that face-to-face interview. And then from there, you really have the opportunity to sell yourself and explain and provide a little more context as to how your skills, your soft skills and technical skills, will be a addition to their team and how your talent can really apply to what they're looking for. All three of my jobs, opportunities that I've had at the clinic have all been based on someone I knew. Those walks that I took with Serena when we would go get Starbucks and then walk around and we would do the small talk conversation, every single one of those, my job opportunities was because of those walks that I took with her. The first one, Kristen and Guido, I met them waiting for my coffee at Starbucks with Serena. And when I saw that job posting with Quality and I saw that Kristen was the hiring manager, I shot her an email with my resume. Hey, can we just have a discovery conversation? Absolutely. 30-minute conversation. And at the end of the conversation, she said, hey, I want you to go ahead and submit your application through Workday so we can do the formal HR process. But I'm going to tell them, I'll tell the recruiter to push your application through. So even though I didn't have the necessary requirements for a project manager one, which was 1 to 2 years of experience, my resume still got pushed through because Kristen connected with the recruiter and told her to do that. My second opportunity with critical care, Jeff is a Bobcat as well. He's an OU alum, and same type of thing. I met him through Serena, and we had connected, and just he had kept me in mind. And whenever an opportunity had popped up in his department, we reconnected. And then he told me to go ahead, submit your resumes for the formal HR process, and then we'll go through the hiring process. So it's all about, a large part of it is about who you know, but it's not only about who you know. You can know the key players in the game, but being genuine and really being able to know how to connect with people and sell yourself and communicate how you can add value to their team is a huge part of it. So knowing people get your foot in the door, but then it's time for you to shine and really be able to sell yourself. I always say that, I've had the opportunity now to be a hiring manager. So I interview doctors, clinical associates who they're doctors, they're just not staffed yet. Physician assistants, nurse practitioners, our administrative staff. I get to interview all of them. And honestly, the golden rule has applied so much. Knowing how genuine they are and intentional they are on those conversations is such a key driver for my opinion about how the interview went and my thoughts about them. I'm going to pause here for a minute before we move on to the next part about connection, because there's some questions. So how did you avoid burnout and stress during the pandemic while working so closely with COVID-19 and long COVID? Well, the honest truth is I don't know that I did avoid it. I think I am definitely getting to the point of, or was at a point of burnout, being completely honest with you. What I will say is when I started to notice those signs of burnout, I kind of did take a step back in terms of remembering what I value. And I've always promised myself that I would never lose my values or sell my soul, so to speak. for a job. I love my job and it's a very impactful job, but at the end of the day, where I'm at here, this is my home and my family. So when I started to kind of notice that I was just getting so tired and really not putting my best foot forward, um, I honed in on some hobbies. I started going to CrossFit, which was always something I wanted to do, but I was nervous about. And then I really just focused on my other hobby, photography, and really valued that. My faith has been a really huge factor in not letting my brain kind of go to those deep, dark places that I've seen a lot of our employees go to. Um, and so, holding tight with my faith has been a really key driver for me as well. It was tough because, I was for the past year and a half now, I've been in the office every single day. I'm driving to work and I'm seeing people on their phones, on their walks, like, taking meetings while walking their dog. And that kind of stunk for me. Um, and then we actually, for a while, the clinic had shut down all surgical procedures. So even our clinical staff and nursing staff was at home, still getting paid, but they were at home. And so I was, in the office for 12-hour days, 7 to 7. And so I was just kind of like, man, that kind of stinks. Like, you know, so there was definitely some feelings I had to work through, but that's a great question. Um, have any of those product recall pulling projects been more frequent with COVID? Any of the product recall pulling? Caitlin, let's see. The question about product recall, I know we currently have a federal case going on. I can't speak much to, but the product recall, we did have some products that were pulled there for a while with just kind of fraudulent PPE. Our supply chain is the best of the best, and they've done a really phenomenal job kind of running through and making sure we kind of close all those loops. We work really closely with Cardinal Health, and they've really been doing a great job of checking the COVID PPE and stuff like that. But I would be lying if I said we didn't experience it, because we definitely were, and we were unfortunately part of that big federal case that's going on right now as well. So. Yes, Dr. Herr, I am one of the connections for all of you that's participating in this session. So just keep that in mind. I'm very connected, and thankfully to Serena, we can all give our thanks to Serena because of her, I have all of her connections that she has, and more. She's taught me how to use those. Is this field growing enough so that there's room for students interested in health communication? This field is, there will always be a need for administrative and so there's kind of two parts of health communication, I would say. There's the marketing and social media piece, which is only going to get bigger. Why? Because telemedicine this is only the beginning for telemedicine. Back when I was an intern, I had a conversation with a gentleman in genomics, and he said, gosh, we were just kind of tossing around ideas. He said, gosh, wouldn't it be crazy if you as a pregnant woman could just have a monitor on your belly, and then you wouldn't have to go to the doctor every other week or every week, or even if you were high risk? I was like, wow, that would be kind of cool. And here we are, we have things like that. It's not taking long for these innovations to kind of kick up, and they're just going to continue to grow. We're seeing it from an accreditation standpoint, meaning licensing and stuff like that with our physicians, and it's only going to continue to grow. So social media, absolutely, there's a huge need for marketing and social media. I will say they link very closely with legal, because when you work with social media or marketing for the clinic, you have to ensure that everything you say is politically correct, and it's approved by legal to ensure we avoid different lawsuits and things like that. And our marketing team and corporate communications team, they are having a run for their money this year. They are busy with interviews and media outlets. They are just slammed. So they are hiring. And if that's something you're interested in, they are taking interns as well. So I'll just put that out there. And And I am very familiar with Heather Phillips, who she oversees all of the marketing and communications. So if that's something you're interested in, please reach out. What advice would you give the students to build the self-confidence to start building the interpersonal relationships that led you to job connections? Caitlin, that's a great question. And so I'm going to kind of, with that question, I'm going to jump to emotional intelligence. I'm sure many of you know or have heard the term emotional intelligence. And so what I would say is that when you're building these relationships, there's a blunt truth that I think it's not going to be a popular thing that I'm about to say, but it's the truth. And it's something I experienced and something that I think if you know about it, it's easier to just kind of prepare yourself for. It's definitely getting better, but a place where the average age of folks of doctors, it's much higher than a 20-year-old when I started out in healthcare, right? Simply because they have to go through so many years of schooling and things like that. And it takes a while to land fellowships and then land a full staff job. They're very experienced and they work very hard to get to such a prestigious institution, health institution. So being a young professional, especially since I was 20 years old, there's a certain perception about me that others had. And that's just the honest truth. The perception that I was green, that I didn't have the experience, I didn't understand what I was talking about. I had very little understanding about healthcare, and that I had very little understanding about how to be professional. Now, while some of those things are true, I really had very little understanding of healthcare, and it's very complex, especially a system as large as the Cleveland Clinic. Some of those other things I had opportunities to kind of prove myself in. And the major opportunity was the professional piece. So understanding emotional intelligence, my self-awareness, my self-regulation, my internal motivation, having empathy and my social skills, all of those, being able to hone in and really polish those skills allowed me to build trust, gain trust, build trust, have people build confidence in me. The humility to say, hey, listen, I don't know everything. I'm here to learn. Rather than giving statements, asking questions, that presents a sense of humility, and that comes across a lot more palpable than a young green 20-year-old telling a bunch of doctors they don't know what they're doing and that their hospital-acquired infection rates were so high and that they were harming patients, right? That doesn't come off very great, but rather asking questions of, I don't understand this, but how can we work to figure this out? And what can I do to help you and to make your job easier? So approaching the situations in those types of projects like that. Sometimes hearing these things, you're probably like, oh yeah, duh. But I will say I have seen a lot of meetings that go south because the person facilitating may not have great self-awareness about how they may be coming off, or their self-regulation. So their ability to kind of direct or control their impulsive responses or judgments about certain things. They just kind of blurt those things out. And then that kind of throws the conversation and the room off a bit. So that was really how I worked to kind of build up my interpersonal relationships with the key leads on these projects. It took a while for me to build my confidence because I was aware of just how differently I was kind of treated or was kind of spoken to. I had to work on my self-confidence, but I had a great mentor and a great boss who really instilled the confidence in me and helped me to kind of gain that confidence much quicker than I would have been able to on my own. So finding a great mentor is so important, very, very important. What can I do to make your job easier? Yes. Do you have any tips on maintaining connections after you make that initial connection? I do. So I would say, sometimes people always say, oh, reach back out and keep in touch. That can be kind of awkward sometimes, like, hey, just checking in. I like to have more of an organic kind of relationships. Luckily with the clinic and being downtown, it's easier because when you're walking to meetings and things like that, you can see people. But so it just checking in with them naturally was really my approach, and learning about them personally, and checking in with their about their kids or about their home life, really helped to build those connections. And I'm gonna just pause 1 second because my lovely dogs, I'm gonna take them out for just a second. Okay, so sorry about that. Let's see if there's any other questions. Okay, I think that's all the questions for now. So back on a little bit more on emotional intelligence. Um, so just reviewing back with those, and I'm sure you guys probably know these 5 components, but I would really maybe just take some time before you have that first interview, or before you start thinking about your first job that you want to apply to, just kind of do some self-reflecting on kind of where you're at and be honest with yourself. It doesn't do any good to kind of, you know, brush it off and say you're good at something that you know you have opportunities to work on. And we all have opportunities to work on things. So um, really just taking a look at the self-awareness, your ability to recognize and understand your personal moods and your emotions and what drives you, and not only recognize that within yourself, but being able to recognize the effect that it has on other people. I use this in my marriage, which this is also having high emotional intelligence is great for your marriage. As someone who is newlywed, it's very helpful. um, Self-regulation, the ability to kind of direct, you know, your kind of gut reactions, or those initial just thoughts or impulsive thoughts or judgments, just kind of pausing, digesting it a little bit, letting it kind of like marinate, and then taking the approach of asking a question rather than providing a statement. That internal motivation, so that passion, making sure you have that passion for internal reasons, not for money or status. I will say right off the cuff, if you want to work for a hospital, you do not make much. It takes time to make good money, as they would say. So many of my friends that are working for medical sales and things like that, I was definitely at the lower end of pay. And I will tell you, for the past year and a half, the type of work that I've been doing and the hours I've been working, people would probably think I was crazy for doing that. But it's a passion that I have. And so you have to have that passion. Otherwise, you will get burnt out really fast. Having the empathy and the ability to understand other people, um, this is huge. And, you know, patients can be challenging, right? Um, they're in a place of hurt a lot of times, and so are their families. And so a lot of times the reactions that they may have aren't necessarily what they mean to have. And even as an admin, sometimes I have to be the one to kind of, I hear them um, in the hallways, or you know, things like, and you have to be the one to deliver the policies or the bad news, right? And so just understanding and trying to relate to where they're coming from is so key. And then the social skills. I mean, being able to manage these relationships and building the networks and the ability to find common ground and build that rapport, it's so important. You're going to come into conflict. Conflict is good as long as it's productive conflict. And being able to manage conflict well is so important. Um, Something I always do to kind of help me manage conflict, because I'm very much a person of, oh, I could have done something better. I like to kind of split conflict up into 2 different types: a personal conflict and a process conflict. Personal conflict is very rare when you really think about it. And most of the time, it's, especially in the workplace, it's process conflict. So when you're in a meeting and there's reaction or feedback that the team doesn't like where the project is going, it's very easy to take that as personal, right? Especially for someone who's type A, it's very easy for you to take that as, I didn't do a good enough job. But being able to kind of digest that and say, no, it's just simply a process conflict. And let's see what we can do to figure that out. It saves your emotions from kind of throwing in additional muddying the waters, I guess you could say. And then it also saves face for the team members as well. You're able to get a lot more work done that way once you realize and are able to really utilize good conflict resolution. So that's key. Conflict resolution is very necessary, and practice it. Practice it in your relationships. Practice it with your friends. It's so important. The last piece, the last strategy that we'll kind of hone in on is mopping the floors. So I know this is probably kind of like a weird way to put this, but I'm hoping that it kind of like sticks in your brain that some girl at the clinic told you to mop the floors. And what I mean by this is always be open to doing any task. Whatever it takes to get the job done, be the person that says, I'll do it. So if you're sitting around and they say, hey, we just need someone to mop the floors. Okay, fine. Mop the floors in heels. It's okay. Like, be that person, because the person that is willing to just take on any task that comes at them and that needs to get done to accomplish the bigger goal, that's the person that continues to get offered opportunities. And when you continue to get offered opportunities, you continue to have the opportunity to connect with more people. And when you continue to grow your network, you continue to grow in your career and your professional development. And that's what ends up landing you those key or milestone jobs and projects, for in my instance. So even this is, again, another strategy that I learned with Serena. When we would be walking, she would pause and pick up trash off the floor. She would, if there was a patient that was lost, we would stop and walk them to their appointment. If someone needed something carried from the roundabout to the unit or to their room, we would stop and we would do it. It didn't matter who we had a meeting with next. It didn't matter what tasks we had to get accomplished that day. We stopped and did what needed to be done at that moment, because that little task ultimately was feeding into the bigger picture of making the clinic the best hospital in the nation, or number two. And this is something that Dr. Mihaljevic talks about too, when he was first getting, when he was touring and kind of going through the recruitment process for the CEO search. He was actually, one of the assistants went and picked him up from the garage, and they were walking him back. And they had Dr. Mihaljevic. They knew he was about to be the next CEO, and there was a patient that was lost. And so the assistant looked at him and said, I'm so sorry, Dr. Mihaljevic, please wait here. I'm going to walk this patient to their appointment. And he says it out of his own mouth. That was the moment that he decided he wanted to take this job. Because when you value those small tasks, or those tasks that maybe not mean much, you have attention to detail, and it brings you back to the real reason why you're at work. So mop the floors, take the trash out. When the housekeeper comes to your office to take your trash, bag it for them and put it in the trash yourself. Never have a task that's below you, and always be ready to just take on anything that needs to get done. There is a balance to that, making sure that you don't overload yourself or overcommit, but I think you kind of get the gist of it. So be the person that gets stuff done. Yes. That is, so it's funny you say that, because recently we were hiring an admin coordinator in our department. And when I asked her the question, I said, Jen, what would you say if I were to ask one of your previous colleagues how they would define you or describe you, what would they say? And she was like, they would say, Jen is the type of person that can get things done. No matter how big or small, I can get things done. I figure it out and I do it. And that line was why she got hired. I mean, in all honesty, because my boss wasn't his top candidate. And I told her, I told Jeff, I said, Jeff, I said, we need people that can get things done. Someone that can figure it out and then get it done. And he was like, you're right. And so we hired her, and she's been hands down one of the best hires we've had in the past 2 years. So be that person, be the person that gets stuff done. So that is all I have in key kind of those buckets. So finding connection, honing in on genuine connection, being intentional about relationships, beyond just professional. Ask about people's family, ask about what they do in their time off. Go deeper than the, hey, how are you? Good. Go deeper than that. What'd you eat for dinner? How was your weekend? How are the kids? Go deeper. People love to be asked. People love getting asked questions about themselves. When you don't know what to talk about, ask them about themselves. They'll talk about themselves. Have that emotional intelligence. Hone in on how you're feeling and how maybe you're coming off and how that can affect others. How can you strategically place yourself to make others feel more comfortably or align with others? And then make those connections. How can you read the room? Read the room, figure out where the vibe is, and then strategically place yourself to kind of manipulate that and make it a productive room, a productive facilitation. And then mop the floors, do the tasks that just need to get done. Get things done, and be the person to always volunteer first and say, hey, I'll do it, no problem, I'll take care of it. Because that's what lands you the opportunities and the career growth and the professional growth, and build your network up. So let's see, here we go. Another question. What advice would you give to your younger self in college classes in the midst of midterms? What advice I would give you is, I think all too often, I focused on getting the answers right rather than understanding the concepts. And so the advice I would give myself in college classes is focus on understanding the concepts and connecting them to your real life versus just getting the answer right on the test. Because that is so much more applicable and to the real life. You don't gain anything from just memorizing the answers. There's so many times I've thought back to the communication accommodation theory. Sounds so silly. I've taught my husband about this theory many times, but how I pick up and I notice the way we kind of change to mimic other people. And why do we do that? So really just kind of dive in and understand those theories, because you will see them come to life and you will see the value in using them, especially in communications. What are your goals? Where do you envision your career going in the future? So where I envision my career, I never, one of the things I'm keen on is I never set like a hard stake in the ground of what I want to be when I grow up type of thing. Instead, I try every year to kind of chisel down and become a little more concrete about what I enjoy and what career offers that. Right now, I'm at a point where I liked project management, I do, but I value so much more the operations and managing people and working with teams. So I definitely see myself moving more towards the direction of an administrator of a department. And so that's kind of where, as I've started to look at my next steps, I've been in the position about 2 years now. And so it's kind of about that time I start getting a little wiggle room to say, where am I going next? And so that's kind of where I see an administrator of a department. And then next up from that would, if all goes well, an institute administrator. So that is where I'm going in the future. What are your goals and where do you, okay, that one, I think that's just popped back. Any other questions? Based on your experience, oh, here we go. Would you ever go back to school for health administration? Do you think that's necessary? Because no. So what I will say is that it is becoming more and more necessary to have a master's to acquire leadership positions. So I am, if I if I achieve the department administrator role, that will probably be the last level that I will be able to achieve before needing a master's to continue on. So if you would like to if you are looking to get your master's, I would definitely say get a master's in health administration would be a great opportunity. The other thing I would say is a master's in any type of AI, so artificial intelligence or data analysis, any type of data or telehealth. Those are all, that's where we're going. So that's really the future of healthcare. So that would be something to consider as well. It's not often that I look at the degrees that people have on their resume. It has to be somewhat applicable, right? But I think really the experience and the type of skill set that they have, that's what I really hone in on when hiring into different positions, especially for administration and healthcare. Based on your experience at the clinic, if you were teaching a course in health communication, what topic areas do you think would be critical for students to explore? It's a great question, Dr. Deerdorf. Always has very good questions. So I think there's a couple key pieces. One area of study or topics that would be critical is Excel. And I'm not kidding when I say this. A whole entire course on how to use Excel and Tableau would be so valuable. I've spent more time on YouTube trying to learn Excel in terms of data analysis and shortcuts to cleaning up data and linking different columns, and it's taken up so much of my time, and I wish I would have taken more time in college to understand and learn Excel through and through. And the programming, because you can also program different things in Excel. So if you have a strong Excel experience and background, that is so key because that links right into data, and data is the key driver for healthcare. Everything we do is based on data, research, our outcomes, any of our measures, any improvement projects we're doing, our business, our finance data, it's all based on data. Data drives everything. So understanding data, knowing how to use it. There's so many times where I use, back to my statistical communication class that we had, I use a lot of that information that we had that I learned in those courses. So understanding data, understanding process measures, outcome measures, specific to healthcare, or just in general, and how to take numbers, understand them, and then create it into a narrative for other people to understand. That's key as well. That's something I do a lot. Our physicians, some of them are very, very keen in understanding, and they get it, they grasp it, but others, their interests just lie other places. And so they just need you to tell them what they need to know so they can make a decision. So being able to create a narrative from data points would be huge. All right, any other questions? Intro into Microsoft Excel. Yes, and there's also, I will tell you all about this. On Instagram, there is a girl who has, and I just found her because I'm not kidding. I have been learning Excel, especially since the new 365 just launched. Her name is the Chief Excel Officer on Instagram. You can look her up and follow her, but she gives you these little quick tips about Excel. It's wonderful. So highly recommend that as well. Any other questions? I don't see anything else. Well, thank you all so much. I'm going to put my email in the chat, my work email, so you can all, if you are interested, if you're interested in seeking jobs at the clinic, I was just mentioning right now is a perfect opportunity because we are opening up our London location. And so we're looking for people who are not tied to the United States or Ohio and want to kind of travel and get a job in London. So London would be a great opportunity for anyone who's wanting to start out. Florida is also a great opportunity. We are expanding like crazy in Florida. We just acquired another hospital system. And so we're not acquiring hospitals anymore, we're acquiring the systems. So there is a lot of admin and support staff that's needed for those acquisitions. So Florida would be a great option too. So if you are interested at all, shoot me over your resume, but then also please tell me what you're interested in so that I can get you in contact with the right people. And it just makes my life a little bit easier too. So I can read your little, just a bullet. It doesn't have to be anything formal. I'm a very informal person. So you can just write a bullet points of things that you're interested in or areas you're interested in. I can look at the jobs and then pass your resumes along. Bobcats always take care of Bobcats. That's what I've learned, especially at the clinic. There's a huge alumni group. And so we're all really tight and we stay close. Thank you guys so much.
Riley, thank you so much for joining us tonight. This is a big virtual hug, but also pat on the back. We are so incredibly grateful to call you an alumna, and we look forward to you being on campus next time.
Yes, hopefully soon. That would be wonderful. So please reach out if you have any questions. I'm happy to connect you guys and to be a point person for you. I will just preface and say we are extremely busy. So if I don't get back to you in a couple of days, it's just we're trying to stay above water right now, but I will get back to you, I promise. So thank you so much for understanding.
Thank you, Riley. Thank you, Beck, for getting us started. And thanks to everyone. Go in peace, make good choices.